I'm Len May, and I'm the CEO, co-founder of Endocanna Health. We're an endocannabinoid genomics company, and I have the distinct pleasure of having Dr. Chris Spooner join me, who's a naturopathic specialist, and we're going to discuss this topic and many others. Tune in. Thanks.
Lifestyle. It's interesting right now because what's going on and people are stressed about, their work and that they are keeping their social distance from other people and not having that sense of community. I really think that you mentioned a couple of these things, looking to see what you can do to make the best of the situation you have in hand, not only looking at cannabinoids as your solution for everything, but maybe that's a tool, and you spoke really eloquently about that, but also expression. So looking at are you meditating? Are you getting exercise? Are you doing yoga? What can you do at home? You can't, we don't have, our gyms are closed. So can you do that at home? Can you get some exercise? Can you go for a walk outside? Can you go for a hike? Can you spend more time with your family? And, I look at some of the people and some of the conversations that are going on the internet, and people are like, oh my God, I'm cooped up in the house. I can't leave. I can't go anywhere. But they're not looking at the aspect as that our lives are so busy. We're everywhere. We're always out and working. This gives us a chance to kind of go inward and reflect, and combining that with whatever herbal remedies you have, vitamins, nutrients, getting good sleep, putting good food into your body, and having that sort of mental attitude. I think there is, if you can see a silver lining, I think there is somewhat of a silver lining in this, that it sort of lets us see what's really truly important in our lives and still have the sense to build that community. And for for companies like us, for instance, making sure that we are positioned to work remotely and still to interact, like having this type of technology that we can speak to each other, hundreds and thousands of miles away from each other, and build that sense of community. I think those are all different things that people can take back and maybe reduce their stress levels during this time as well.
Yeah, and I think it's really interesting because, when I first got into naturopathic medicine, and that was 25 years ago, I was inspired to get into it because there was a holistic perspective, and there's a feeling in the naturopathic community about, hey, we want to make societal change. We want to look at a place and a type of medicine that's more person oriented, that respects the individual, that honors these elements of how we heal, and honors all the elements of our social connectedness and our connection with the planet. And it's interesting that when I ended up getting into the cannabis space about 10 years ago, right, I was drawn to it for the exact same reasons, is because when you meet with the community in the cannabis space, it's that same type of sense of hey, we're going to try and make a change. Legalization's coming. Look at this. And there was a bit more of a holistic. And I think, it's interesting as we sort of see the commercialization of cannabis and how that's putting the stressors on this. It's starting to pull that community in different directions as we get, some things, the commercial aspects start to become, we've got public companies and things like that. So there's an interesting analogy there. And I think, you're absolutely right around sort of talking about kind of the silver lining of this. This is an opportunity to really connect with what is super important. It's really, it's an opportunity to step back. Personally, I'm like, hey, okay, maybe I should quarantine because I need 2 weeks just to kind of decompress and actually start to find some balance again a little bit as well too, and reconnect with people that I haven't seen in a while, whether, obviously we're not going to do it face to face, but still just to be a little bit more aware of that and to sort of take a bigger picture about, how we work together as a society and how we work towards the common good. And that's why things like, the social isolation and it's not, you may not get COVID, you may be like, hey, I'm going to continue smoking my cannabis and I don't have to worry about it because it's not going to affect, I like that and all the rest of that, but I'm still going to stay home because I've got grandparents or people with chronic health issues, or, if I catch it, what happens if I've got to go into the hospital and now someone's got a rash in a ventilator or something like this as well too. So I think, the community should really step back and really kind of connect with some of the underlying principles in this time of real change. And part of that is we're in this together. How do we support each other and how do we try and just look out for each other and take care of us. And I think there's an opportunity there, but I think that doesn't get stated enough, and it kind of gets lost in the media furor.
Hey everyone, I hope you found this information super helpful. Please don't forget to subscribe below right here, and stay tuned for all the latest and greatest from Endocanna and what we have to say about your endocannabinoid system and DNA. Because remember, cannabis is personal. Stay healthy, stay well. Thank you.